Welcome to the Embrace Her Legacy podcast, the #1 personal development classroom for millennial women, hosted by Embrace Her Legacy founder and CEO, Maria I. Melendez. Ladies, get ready to evoke your feminine confidence and be inspired to master your relationship with yourself so you can fabulously live your legacy. If you enjoy this podcast, please make sure to subscribe. Don't forget to visit us at embraceherlegacy.com, where you can support our mission by making a donation of any amount or sign up to become part of our community of volunteers and supporters, the Embrace Her Legacy Collective. Our vision is for every woman and every girl to defeat her inner saboteur, master her relationship with self, and live out her legacy unapologetically. Enjoy the podcast.
Hey, what's going on, everyone? Welcome to the Embrace Her Legacy podcast, the #1 personal development classroom for millennial women of color. And today, the episode that we're going to be talking about today are challenges around infertility. This was an audience request last season. We didn't get to it. I know a lot of women struggle in this area and struggle in silence. I have friends, family who have, and even when we speak about it, there's a certain level of shame attached to it, and guilt and all these negative emotions. But I think that if we start talking about it openly and start educating one another, that this can be really an informative tool that we can use to uplift and let each other know that you are not alone if this is you. So I just want to start out, if this is something that you are struggling with, I just want to give you my warm, heartfelt prayers and positive vibes and positive energy, because I can only imagine the journey. But I'm not by myself, and I don't know anything about infertility, so I called the experts on this one. Our guest today is Miss Leyla Bilali, who is a fertility specialist and who is a registered nurse, and she is going to be answering all of our questions. So Leyla, introduce yourself to the people, let people know a little bit about you, about your Instagram, all that jazz.
You got it. Yeah. So I have been a nurse in fertility for about 7 years now. I've been a nurse for almost 12. I used to work in pediatrics, and I kind of shifted to the before. It sort of fell into my lap. I interviewed for a recovery room job. I just wanted to learn some new skills, some OR skills as a nurse, and they kind of pushed me more towards being an IVF nurse, is what they call it. But we don't just deal with IVF. Of course, we deal with all types of fertility treatment. So I've been doing that now for almost 7 years. And I work at a private clinic in the city, in New York City. And at the suggestion of one of my patients who I was helping with her injections, there are a lot of injections involved in the process. And she kept urging me to start my own consulting business, and kind of, I handhold people through the process. And so at her urging, I kind of looked into it and started my own fertility nursing and consulting services business as well, which is called Fertility Together. And that's my Instagram handle as well. It's Fertility Together. My website is fertilitytogether.com. So basically I do all of the support, the emotional aspect of it, but I can also guide you, medically speaking. I have all of the training and knowledge on the medical part, as well as the emotional support, which you need a ton of emotional support for this as well, of course. But yeah, I can do both sides of it. So
wow, that's pretty incredible. So your services will walk you through the physical challenges of infertility, as well as provide those emotional support, because I can only imagine that it's probably even more emotional than it is physical when you're dealing with infertility. So, and we're going to get to those questions in a second. So let's start with the basics. Mm-hmm. Can you just explain what that term infertility actually means?
Sure. Yeah. So technically, the textbook definition of infertility, if you're 35 and under, is 6 months of trying to conceive. 35 and under is a year of trying to conceive without success. And if you're 35 and older, they consider 6 months to be the cutoff. So that's the technical gauge for it. That's what insurance typically uses for coverage purposes. It's a little bit crazy because 35 is not the same for every female. Everybody's, DNA is different.
I'm 35. Well, I turned 36 in about 12 days, but still, like,
Oh, yeah.
So
I had no idea, honestly. The things that I learned, I started working in fertility when I was 28. And the things that I learned just about my basic period, about my menstrual cycle that no one had ever taught me until 28 was kind of mind blowing. So I get it. Yeah.
I hear like mouth drop. Okay. So I totally understand how that 35 can look scary, but now that you said that, it makes me even more scared. Like, oh my God, 6 months. And this was a question I had anyway, but what if you were on birth control and now you're off at 35 and then you're having some issues? Does that still count as infertility?
So technically, not resuming a normal period or anything like that for a few months after coming off of the pill is very normal. But again, nobody's really educating people on this. So we kind of just put people on the pill and we don't tell them what to expect for if and when they're ready to come off of the pill or try to conceive after coming off of the pill. So there are a lot of things that go into that. And again, it's just unfortunately a lack of education. I feel like the last time we learn anything about our menstrual cycles or how any of this works is maybe in like sex ed in the 8th grade. And basically all they told us there was don't have sex.
That was it.
Or you'll get pregnant. So
okay. So Leyla, now you have to spill the tea and let the people know what are those, I guess, tips and pointers that we should share with each other about getting off of birth control and then trying to conceive.
Yeah, so there's a common misconception that birth control itself can cause fertility issues. It's not so much that's the case. It's actually unlikely that that's the case. The issue with birth control when it comes to fertility issues is that it can mask an underlying problem. So if I'm on the pill from age 22 to 32, so 10 years I'm on the pill, and then I'm ready to come off and try to conceive, for those 10 years, I didn't know what my period was like. So I didn't know if I wasn't ovulating properly or wasn't ovulating every month or anything like that. So the problem with the pill is that it can mask an underlying fertility issue. It's not that it causes the issue, it's just that it can mask it. So one of the, important things to do is to consider when you come off, it's not like you come off the pill, your period resumes right away and everything resets. It's actually more common for you not to get your period for a couple of months after coming off the pill and things like that.
What?
So even, it's even before going on the pill, I recommend people to make sure they're asking their physician to check for certain things prior to being put on the pill.
And what should those certain things be that we should check for?
Yeah, so some people have underlying conditions like polycystic ovarian syndrome, PCOS. With PCOS, you don't regularly get your period, you don't regularly ovulate. And so if I'm on the pill and I would never get my period, I wouldn't know which it's from, right? So there are tests that can be done. There's blood work that can be done, ultrasounds that can be done to check for something like PCOS, for example.
Okay.
So, it's important to, it's really easy for them to just throw out the medication. I don't think there's anything wrong with birth control. I think it's actually quite wonderful, and it can help with, even if you just have painful periods, it can help a lot with that. I just think it's important to ask your physician if there's anything that we need to check for prior to going on it. And if you are thinking about coming off of it and attempting to conceive, again, check in with your doctor and let them know, how long should I wait if I'm not getting my period? How long should I wait till I come to see you and have a workup done to see exactly what's going on?
And are those same birth control, I guess, parameters coming off does that require for every type of birth control? Because you mentioned the pill, but we have the ring, we have the what's the one that the depth? There's a lot.
The injection, the Depo-Provera injection. There's the IUDs now. So that really pretty much goes for everything. They're all working via the same methods. So it really goes for any of these that you're going to be on, to do your due diligence prior to. And then if you're thinking of coming off, same thing, ask your doctor what to expect upon coming off and how long you should wait before coming to see them for a workup if things aren't resuming, as they should.
Okay. So are infertility issues more common than expected?
They really are. And it depends on, I always say that it also depends on where you live and the personality types of the population where you live. For example, in New York City and in other big cities like that, Miami, Chicago, LA, we see fertility clinics thriving because we have this instant gratification, type A, career-oriented population, and everybody's go, go, go. So if I tell you at age, 30 to 35, that the average time it takes to conceive is a year.
Is it?
It is for that age. That's very normal for.
I'm in that group. I am in the group.
It can be very normal. And when you tell people, they're like, why would I wait a year if I can just go to a fertility clinic and, figure this out? And the answer really is you don't have to wait if you don't want to. But yeah, it is average in that age group for it to take a year. So it's more common than you would think, but it also depends on lifestyles and how long somebody wants to wait for. It's a personal preference. I might not want to wait a year, even if you tell me that that's the average and that's normal.
And this is like even without birth control. Like I wasn't using birth control. I'm just out here, dipping and doing it with my man. And it's going to take a year.
It can. Absolutely. Absolutely.
Wow. Okay.
Yeah. Even if there's nothing quote unquote wrong, you do all your testing and everything comes back clear. Yeah, it could still take that long.
Wow. I have so many questions about the myths. Like, if you do it like this, and I hate to get graphic, right? But hey, we know where babies come from, right? So I really like the myth that if you do this, and if you have sex like this, in this way, in this position, right. Is any of that true, Leyla? Like, does it matter?
No, I mean, I wish it were that easy. I wish those things were true. It would make our lives a lot easier. There's the myths that you should lay down right after having sex for at least 10 to 20 minutes, that you shouldn't pee right after, which then...
Yeah, I've heard that one. The pee one. Right? Yeah, I've heard that.
And people end up with these crazy UTIs because you should be peeing after. And there's really no truth to that. Your cervix pretty much closes up after about 10 to 20 minutes.
Okay.
So the theory of laying in your bed for like an hour with your legs up in the air, that's not how it works. I wish it did. I wish it were that easy, but it's just not true.
Oh my gosh, I'm laughing at all those words. So you mentioned our lifestyles and infertility. How can our lifestyles affect fertility or the lack thereof?
Yeah, so things like weight, and people usually associate being overweight with any type of health issue, so they assume that it would just be overweight, but actually we see a lot of patients who are underweight. So if you have a very low BMI and low body fat percentage, it can definitely negatively affect your cycle. Your cycle is very, very sensitive to being underweight or overweight. And
what's BMI, Leyla? Because I don't know.
Sorry, your body mass index. Your height and your weight.
Okay.
That they calculate. So a BMI of 17 or less could put you at high risk, just as a BMI of about 30 and up can put you at risk. So being underweight or overweight, they both can have a negative impact on your menstrual cycle and therefore your fertility. So that's a huge lifestyle one is your diet and exercise and your weight. Stress. We know that stress negatively affects your body in all sorts of ways. And your reproductive system is no different. So stress, high levels of stress and cortisol, the hormone cortisol that goes up when you're stressed, that can negatively impact your fertility as well. So those two things are huge in terms of lifestyle. For men, it's so much easier with lifestyle changes. Like if somebody, let's say you like to smoke, and you stop for about 3 to 4 months, you can reverse those effects on sperm. But unfortunately, it's much harder to reverse those kinds of things with your eggs. So once the damage has been done to your eggs, it's a lot harder to work backwards, unfortunately.
Oh goodness, this is a lot. This is so interesting.
Mm-hmm.
Okay, so you mentioned men. Is there a difference in like one, do men struggle with infertility? One, and two, like what are the major differences in infertility in men and women?
Well, let's start with one of the huge roadblocks with men is that they don't even want to get tested. They don't want to do a semen analysis. And they're so sure that it's their, female partners that are the issue. And unfortunately, that's just not true. Like I said, even something like smoking can affect your sperm count. Wearing really tight workout pants, taking hot baths. Taking hot baths can affect your sperm counts and things like that. So it's very important for men to have a semen analysis done because there is no other way for us to know. You can have semen and not have any sperm in it. And there would be no way for us to know without testing it.
Oh my gosh. I know I sound like an idiot what I'm about to say, and I have no problem saying it. I didn't know there was a difference between semen and sperm.
Yeah. So semen is the actual liquid that the sperm is in, but you can have semen without actually having active sperm in there. You can have sperm and it not be good sperm in there. You can have no sperm at all. There's all sorts of variations. So this concept that men are often too proud to even have the testing done.
I was gonna say it's probably an ego thing. Of a
Absolutely.
man if something's wrong with my sperm. And you said there could be good sperm and bad sperm. Elaborate,
Absolutely.
please, Leyla.
Absolutely. The shape of their heads is very important.
You might like for those of you who are listening in the audio, my mouth is dropped. I'm like, what? And the only way they can find out whether they have good or bad sperm is to take the test, right?
Yeah, so basically they ejaculate into a cup. We give them a sterile cup. It can be done in a fertility clinic. They have rooms for it, or it can be collected at home and brought into the office. And we basically have them ejaculate into a cup and run a couple of tests under the microscope. And we can tell you a lot about the male fertility aspect just from that. So it's very easy. It's just that partners are often, or male partners are often very hesitant to do it.
This is brand new to me.
Mm-hmm.
Okay, so we talked about like how our lifestyles can affect infertility, but what are other causes that can affect infertility? I know you mentioned one, PCOS,
Mm-hmm.
and other things. What are other things that could perhaps affect our infertility, our
So
fertility?
other things that can affect it are structural issues. So let's say you're born with a uterine, malformation. Your uterus is misshaped, or the horns of the uterus. So the uterus traditionally looks kind of like a T.
Mm-hmm.
Let's say you're missing one side of the top of that T, and that's just a congenital thing. You were born with that. We would never know that without doing an ultrasound to check for that. So there could be things that you're born with. You could be born without fallopian tubes. And again,
Wow.
yeah, and you wouldn't know that. So you can be,
You would get your period and everything?
yeah, there are a lot of things that go on that on the outside seem normal, but we would have to check on the inside to see what's happening. So there's the structural issues. There are issues such as PID, pelvic inflammatory disease, which can be caused by an STD. Often it's gonorrhea or chlamydia that goes unchecked, or if you don't have any symptoms of an STD. And it just gets to the point where by the time you have symptoms, it's turned into full-blown PID. It's extremely painful PID. You would know at that point that you had it, you would have symptoms, but by the time it gets there, it can cause a lot of scarring and damage to your uterine cavity and your tube specifically. And that can then cause fertility issues. So yeah, there's a lot of things that, and this is why I think that, if somebody is actively trying or even thinking about trying, getting a fertility workup is the smartest thing you can do for yourself. And even if you're not trying, but you might want to try in 2 or 3 years, there is nothing wrong with getting the education and the workup. I think people are fearful to go and do that. I think they think that if they go to a fertility clinic, the doctor is going to say, all right, we're doing IVF.
Yeah.
That is not the way it works. If that's what a fertility clinic tells you, you should run away. That's not a clinic that you should go to. But you should be able to just have a standard fertility workup, without even having to touch treatment, just so that you know where you stand.
Wow, this is super informative. I'm learning. I'm still on the fact that semen and sperm are not the same thing. I'm still on that. I'm like, oh my gosh. So we hinted on this a little bit at the beginning of our conversation, but a research article says that many couples who want to start a family and are unable to conceive will experience psychological and interpersonal distress that could negatively impact the quality of life. They may end up resenting each other or feeling as though they aren't supposed to be together because they can't conceive together. And woman may feel less like a woman, and a man may feel less like a man. How can infertility affect our mental health for both the man, the woman, and how do we go about getting some help in that process?
Yeah, I mean, it takes a huge emotional toll. Obviously, the females that are physically going through it, they have that added component. But we often forget about the males and how it's affecting them. It affects your sex life with your partner, whether you're same sex or not. I mean, it affects your sex life. It just kind of takes the romance and the
Right.
out of it. It seems very scheduled. So there are a lot of mental health issues that go along with it. And again, that's, part of my services is to hold your hand through the process and to kind of be an emotional sounding board. But there are sex therapists that actually specialize in fertility. There are psychiatrists and psychologists that specialize in infertility therapy. And we do, at a certain point, if we see that couples are mentally struggling with it and their relationship is struggling as a result, we do often refer to these outside resources. Because it's very common. It's more common than not to have the mental component.
Right. Wow, I'm learning so much. Wow, thank you so much, Leyla. Like, I'm over here like, oh my gosh, I never knew there were like sex therapists for this particular issue, right? Oh my goodness. So, our audience, we're speaking to majority women of color. So, do women of color experience more infertility issues than non-women of color?
I don't know that they would experience more per se. I think, again, it also just depends on lifestyles and things like that. I don't know that they experience more, but I do think that there is, this goes for healthcare across the board. I do think that they're not able to access the same care that, yeah. And that's a huge issue. And, that goes for a lot of, underserved populations in healthcare, unfortunately. But I think that they're definitely underserved and the access to care is more limited for women of color that are struggling with infertility.
Oh my gosh, that was actually a research article that we pulled up. It was called Women of Color and Infertility. It said many Black women facing infertility say that they face an uphill battle in getting care. Challenges include not having insurance, covers the cost of infertility services, a lack of Black sperm and egg donors, prejudice from physicians, and feelings of shame and isolation. Those who seek care can find themselves feeling deeply uncomfortable in a medical space that is overwhelmingly white. So, what advice do you give to women of color who are currently on this journey and feeling isolated, maybe having lack of, providers, and then the cost? We didn't even talk about the cost of this. Like, what advice do you give to someone who's struggling with this?
Yeah, and the one thing that you mentioned there that's really interesting is the donor sperm.
Yeah.
It is far more difficult to find non-white donors. And again, I don't know if the marketing plays into that, if the donor sperm banks aren't marketing to enough other populations. But that's a really good point too. My advice is to seek out first and foremost, you have to be so comfortable with your doctor. And I think that the connection that you have with your fertility specialist, even with your OBGYN before you even go to a fertility specialist, that's so important. So if someone feels more comfortable with a physician who is of color as well, by all means, I would do my research and see if you can find that. That might be more comfortable for you. But the intimacy level with your physician is so important across the board. So that can be a huge roadblock in itself. Because if you don't feel comfortable and you're not feeling heard, it's going to be really hard for you to advocate for yourself, especially with fertility challenges. And insurance, yeah, there are a lot of charities and grants and things like that exist now, thankfully.
Wow, there are?
There are. I actually am on the board of one called Pcos, and they're one of the only, grant organizations that are completely nonprofit, and they don't exclude anybody. It doesn't matter your race, religion, whether you're gay, whether you're straight, whether you're trans. They don't discriminate against anybody. And that's something that's really hard to find with the charity organizations, because a lot of the charity organizations that we deal with fertility are religion specific. Yeah, so that's a really tough thing to navigate, but I would do your research on charity organizations and grant. Like I said, ours is called Baby Quest, but there are more and more each year that pop up to help with this, because insurance is seriously lacking in this field.
Oh my gosh! So now we're going into, like, I guess, once you realize you do have an issue with infertility, now we're going into treatment, and treatment being expensive and all this other stuff. So what is, like, assisted reproductive technology? What is IVF? What are all these things? And just explain to the audience what all those things are.
Sure. So assisted reproductive technology is just the overall blanket term for anything fertility wise that we're doing to intervene or assist, that's not quote unquote natural. IVF itself, in vitro fertilization, is when they harvest your eggs as a female. So they basically are giving you hormones via injections, and they're stimulating your ovaries to grow and grow. We want those eggs to grow. Once they hit the mature stage is when we do a surgical procedure to remove them. You're typically completely out for this. I know some countries that they do it without anesthesia, which is pretty, badass. I wouldn't sign up for it, but here in the US, it's pretty much you're out for it. It's like a quick little nap. They take the eggs out and they fertilize them with sperm. So they're injecting the eggs with sperm.
Okay. And can that sperm be from either a donor or maybe somebody that you are in a relationship with?
Correct. Yes. The sperm is up to your choosing, whether it's donor sperm, partner sperm. If you have a what we call a directed donor, that's not an anonymous donor. So you have the anonymous donors that you choose from in the sperm banks. You can also use a directed donor. Let's say I have, a friend who's signing up to do this for me, and we don't have a romantic relationship, but we're going to do this together. So that's always an option too, but they basically take your eggs, they inseminate them with the sperm, and they wait to see how many of them actually develop into embryos. So the sperm and the egg are what make an embryo. And then the embryos are then, once they're developed enough, transferred back into the uterus to attempt pregnancy. So that's pretty much a quick version of IVF. But there are a ton of other fertility treatments that are less invasive that people can opt into if their medical history allows. There's IUIs, which is an intrauterine insemination. That's a really common procedure for same-sex female couples where they get the donor sperm and then we do the IUI procedure for them. And it's basically they prep the semen. They take all the sperm, the viable sperm out of the semen. They put it into a tiny little catheter, and it's kind of like having a pap smear done. They insert the catheter directly into your uterus and, squirt the sperm where it should go. So that's a really common option for our same-sex female couples. So there are a lot of non-invasive steps that you can take before IVF itself as well.
Okay. Is IVF the same thing as freezing your eggs?
So the process is pretty much the same. You just stop after we retrieve the eggs. We harvest the eggs. So if we take the eggs out, exactly. When we take those eggs out, whichever ones are mature, we freeze and then you're done. But leading up to that step, technically IVF and egg freezing are exactly the same.
Okay. So we talked about age, and let's talk about it because I even had this conversation with my provider when I was turning 35. And what advice do you give to someone who's like, getting into her later 30s, there's not a desirable partner in sight, and she's considering alternative options like freezing her eggs? What advice would you give her?
Anyone who's thinking about freezing their eggs, the sooner the better. We struggle with some of our patients who don't want to discuss their age. And I get it. It's a really sensitive topic for us females, but unfortunately it's just biology, it's science. It's not something we can fight. I don't think a 35, 36-year-old is old by any stretch of the imagination. But when it comes to fertility, we have to talk about age. And at 35 or 36, it could technically be, old for fertility purposes. It sounds crazy because it's not old. But you do have to be, first of all, comfortable with speaking about your age when it comes to fertility. There's no two ways about that. We do have what we like to refer to as our unicorn patients who are sometimes 44, 45, and we can get a viable embryo, and that's fantastic. But like I said, that's why we call them unicorns. It's not very common. So for somebody who is in their mid to late 30s or even in their early 30s and they're thinking about egg freezing, my advice is to do it the sooner the better. Go get your fertility workup, get that initial consult, get all of the information, get your ultrasounds and your blood work and all of that and discuss it with the doctor and see, do you have the time to wait a little bit or is it really, I'm glad I came and I should do this now.
Okay. Don't you, and this is what my provider told me, if you are on birth control, if you want to get these tests done, don't you have to get off of birth control for a little bit? Is that true?
That's a great question. So one of the levels is a little bit more, and this is called the AMH level, the anti-Müllerian hormone. We do recommend being off of birth control for about 2 to 3 months at least, so that we can have a better gauge of what that level is, because that level can be suppressed by birth control. So that's a really good question, actually.
Okay. So we talked about older. I don't want to say older because I'm 35 and I'm fabulous.
Me too. I'm right there with you.
Okay, because I'm like, we are not old.
No.
But what about the younger women? Like, I guess the girls who are in their late teens, 20s, and what can they do to make sure that they are staying healthy fertility wise and making sure they're keeping up with their fertility health? And that can go for both men and women.
Something that really surprises me is when I have, like a 30-year-old patient that comes in and doesn't have a GYN.
No.
It happens more often than you think. I think one of the most important things that you can do, whether you're sexually active or not, starting at age 16, 17, start to go see a gynecologist, establish care. Not only are you establishing care for your health, but again, you want to build care with somebody that you then have that comfortable relationship with, so that when the time comes for conversations about fertility or anything else, you feel comfortable. But 16, 17, or even if you want to go when you first get your period and get some more education, go for it. But I would establish regular annual gynecology visits. Super important, so that you're not missing anything that could then later lead to fertility issues.
Okay. Get your pap smears, ladies. That's what she's saying. I am like clockwork on those pap smears.
Absolutely.
So let's talk about I guess miscarriages. Which, if you are listening and you have struggled and suffered through a miscarriage, again, my heart goes out to you. I can only imagine that. Now, what are some misconceptions about women who unfortunately experience miscarriages?
So, one of the most common reasons that somebody miscarries, which most people who miscarry don't know, is that it's often a chromosome issue. So I've had friends, as young as 28, 29, who get pregnant and experience a miscarriage within that first, I would say 6 to 8 weeks of pregnancy. That is so common. But what they don't understand is that it's often a chromosome issue, and the way that a fetus's chromosomes line up, or an embryo's chromosomes line up, are completely out of our control. And actually, that's the reason why the older you get, the harder it gets to conceive, is because the likelihood of these chromosomes not lining up properly is higher the older you get. Your DNA malfunctions more the older you get. That's just aging in general for all of your body parts, not just your reproductive system. But that's one of the most common reasons. And often what I find is that my clients, my patients, think that it's their fault. It's something they did or didn't do to cause the miscarriage, where it's most likely chromosomal most of the time, not always. And you can't do anything about the way your chromosomes line up, unfortunately. So that's a huge misconception, is that it's something you did or didn't do to cause the miscarriage. It is 99% of the time, I would say, there's nothing you could have done or not done to make that happen. But it's very common for women to blame themselves when it does happen. And, if it is a chromosome issue, that's something that IVF is very, very popular and commonly used for, because there's testing that's available where they can test the embryos and see which ones are chromosomally normal before attempting pregnancy with them. So that's another reason why IVF is used very commonly. But that's what I would say is the hugest misconception with miscarriage, is that it's somehow your fault, something you did or didn't do that caused it. And that couldn't be more wrong, although it is the go-to when you're feeling, the repercussions and the sadness and the frustration. It's definitely not the case at all.
How often after, not excuse me, how soon after a miscarriage should someone start trying again if they want to start trying?
Yeah, so technically, your body has to reset. So it depends on the pregnancy hormone level. And your pregnancy hormone level has to go back down to 0 for your body to resume a normal period and a normal cycle to even be able to get pregnant again. Now, this doesn't always happen, and people do end up getting pregnant in the in-between. Okay. And that happens. I would say maybe, like 20 to 30% of the time. But you do have to wait for your pregnancy hormone level to go back down to baseline. And it also depends on how far along you were. So the earlier the loss, the quicker that's going to happen. And the earlier the loss, the less likely it is that you'll need surgical intervention, what they call a DNC. Or if it's even further along, a DNE is what it's called. So it also depends how far along in that pregnancy you were to kind of determine how long you should wait.
Okay. So, what advice would you give to a woman who experienced a miscarriage and now she's scared? She's just like, I don't even want to try. She's fear of experiencing that again.
Yeah, absolutely. I would use your resources. I would reach out. There are so many groups devoted to this kind of thing. There are so many support groups. You can find them on Facebook. You can find people like me. You can find therapists that specialize in this. The key takeaway is that it's so common. I believe the current statistic for miscarriage rate is 1 in 3. So you are not alone. And I would find these outside resources so that they can help you kind of, um, you know, regroup and be able to try again, because once you're traumatized, it's really hard to come back from. But hearing how common it is, and kind of having some better coping mechanisms and learning from other people what helped them to deal with the anxiety after the fact, I think is important. And there's so many support groups out there for that.
Oh, wow. I didn't know. Wow, this is really helpful. I know this is helpful for someone. So, we pulled up a research article that said 35% of infertility in women is due to damaged fallopian tubes. Is this accurate? And if so, how can I check? How can we check our fallopian tubes?
Yeah, and again, going back to the pelvic inflammatory disease, that's one of the biggest causes of issues with your fallopian tubes. So, the things like I said, is if it's a malformation from birth, there would be no way for you to know until you've been trying and you go and have a very specific. It's called an Hsg exam. And they basically, what they do is they insert a dye vaginally, so that they can see where it lights up in your uterus and your fallopian tubes to see what's going on in there. And without that test, really, there's no other test. There's nothing your gynecologist is doing at your annual visits that can check for that. So and that's why it's one of the most common tests that we do in a fertility workup. But yes, fallopian tube issues are very common. The other thing that can cause fallopian tube issues, appendicitis or history of an appendix removal. That's a really common one, because of where the appendix sits, and depending on the type of surgery that you had to remove your appendix, that can cause structural issues or damage to the fallopian tube on that side. So that's another common one too. But yeah, fallopian tube issues are huge to have checked out. And again, your sexual health will become really important in that, like when it comes to things like PID.
Wow, this is really wow. I'm just over here like, oh my gosh. And we've covered so much, and we're like, we're almost at time. So I wonder, and I do like respecting people's time, but whew, I'm just like, I I feel like whoever's listening to this needs to listen to it again with a pen and a paper and take notes, because I'm like, wow, this is so informative. So, is there a special time to conceive, Leyla? Like, we know when you're ovulating, but let's talk about ovulation.
Mm-hmm.
You said no real positions will work. That's a myth. So, like, let's talk about ovulating and how we'll know when we're ovulating.
Yeah, so there are a couple of signs of ovulation. One of the biggest, some people say they feel the cramping that's associated with ovulation. Cramping is kind of a more vague symptom for females. I mean, you can cramp for all sorts of reasons. But one of the good ones to gauge it by is your cervical mucus, we call it. So as gross as it sounds, the discharge that you experience throughout your cycle, when it's at its thickest, it's kind of like an egg yolk, I would say. The technical term for it is Mittelschmerz. It's a German term. But when it's at its egg yolkiest is when it's considered to be peak fertility. Now, you can always do the home ovulation predictor kits and the apps and the things like that. Those aren't the most accurate. Again, the most accurate way is via an ultrasound at your doctor's office. But if you're kind of just trying and you don't want to go anywhere yet and you just kind of want to try naturally at home, what I would suggest is to have sex every other day. First of all, everyone thinks it's every day, but you do need to give sperm time to regenerate. So you want to give the sperm 1 to 2 days to refresh and regenerate and mature. So we recommend every other day. And I would say, day 1 of your cycle, by the way, is when your period starts. A lot of people think that ends your period. But that's when your period starts. So you count cycle day 1 as when your period starts. And then I would say anywhere from day 10 to maybe day 20 to have sex every other day. That's a pretty good starting point. And again, you can always check with your cervical mucus. And as your cervical mucus starts to increase, that means you're inching towards ovulation.
Wow. Every other day? Wow.
Every other day.
I thought it would be, because, and you see the movies and they're like having sex 3 or 4 times a day. But now we know that the sperm may not even be in the semen. So
exactly. See, there you go.
It's like, wow. So Leyla, I just want to wrap up with 1 or 2 more questions. And to bring this to a close, how can we start to talk about this and not feel ashamed and be a little bit more open about it? How can we not feel embarrassed about this stuff?
Yeah, and that's huge. I would say in the 7 years that I've been doing this, I have seen a huge shift in people being more comfortable speaking about it. I have, patients and clients that post on their social media about what it took for them to get pregnant. And I have people that make friends with other people in the waiting room at our clinic, and kind of just talk to each other and start support groups within themselves, which I think is fabulous. So it has gotten a little bit better. But I just think that the notion that fertility issues are taboo, it's just crazy. It's a medical issue, just like any other medical issue would be. We don't shame people for getting treatment for a mental illness. We don't shame people for getting treatment for cancer. We don't, shame people for getting treatment for, all sorts of GI disorders. Fertility is right up there as the same. There's no shame about it. It just happens. It's a crapshoot, and we have to deal with it. And so again, I think that seeking out these support groups and the more people that are involved in them and see how not alone they are, the more willing they'll be to talk about it than outside of those support groups, and make people outside of those support groups feel comfortable talking about it.
Wow. Well, you heard the expert speak to us today. I think that's really helpful though, like being able to understand that you're not alone. And that's exactly why I wanted to do this episode, because I'm sure not only did you help someone, Leyla, you helped me for sure. I didn't know some things that are just like, wow, like why didn't I know that? But also being able to let women know that they're not alone. And to start these communities and Facebook groups. You mentioned organizations that could help out. So yours is Baby Quest that you sit on the billboard of, that helps with granting and funding for that fertility process. So thank you so much. So our final question, since you are the expert, is how can our listeners support you? How can they get in contact with you, learn more about your services, all of that?
Absolutely. So again, my Instagram handle is Fertility Together. My website is fertilitytogether.com. All of my services are listed on there with brief explanations. I do offer an introductory, 15-minute phone consult for anyone who's interested in hearing more about my services. My phone number is on there, email, whatever is easiest for you to contact me. I'm super responsive with any and all of those. So I hope you do reach out. I hope I can help someone.
Well, thank you so much, Leyla. Thank you so much for taking the time to speak to our community, to just inform us and to really empower us that, you're not alone. Infertility is far more common than expected. And there is a way, there are options available. And the great thing is that it's 2021 and it's not 1921, where
right.
2021 we have so many options that you listed off. I was just like, I couldn't keep up. I was like, what? Insert what? Do what? Oh my goodness. So this was really, really helpful and amazing. So everybody, if you, of course, thank you for being here. This was good. So listeners, of course, if you like what you hear, please subscribe. If you know someone who is struggling with this currently, please feel free to share this with her. Maybe this will be something that she didn't know that can help her. Maybe she can even get in contact with Leyla. So thank you so much for listening, and always be a woman who embraces her legacy. Good night.
Thank you for tuning in to the Embrace Her Legacy podcast. If you enjoyed this podcast episode, please make sure to subscribe and visit embraceherlegacy.com to make a donation or sign up to become a part of our community of volunteers and supporters, the Embrace Her Legacy Collective. Make sure you follow us at Embrace Her Legacy to get daily inspiration and join our movement. Thank you for listening, and remember, you're enough, you're worthy, and you're a phenomenal woman who embraces her legacy.